Now, it's a great thing that more and more people are thinking about the need of improving Obamacare by having what is called Medicare for all. Now, I'm getting old enough to have personal experience with Medicare, and I've discovered that it is not adequate. First of all, it doesn't cover all medical expenses, not all physical medical expenses, not all mental, and certainly not all dental care. Nor does it cover all expenses of prescription medicines. Instead, one needs to get additional insurance to cover many of these things. And that additional insurance has co-pays and deductibles that make it difficult for everyone to be able to pay for the Medicare and the medical treatment they need. So we really need a super Medicare for all if we want to really recognize and enforce healthcare as a right. And a super Medicare for all will cover all necessary physical, mental, and dental care. It will cover the cost of all prescription drugs we need, and it will do so with no co-pays and no deductibles. Then we can finally say that everyone has a right to medical care that is being enforced. And moreover, we will have that right by also having complete choice over what doctors and nurses and medical facilities we will turn to. We will no longer be trapped having to follow the dictates of private insurance companies or finding ourselves without the money to get any medical care at all. And if we have such a system, we will be in the strongest position to keep medical costs down, because we will now have a single payer who can negotiate with health providers and pharmaceutical companies to pay them a reasonable amount. We in the United States pay almost $10,000 per person for medical care. In every other developed nation, the cost of medical care is half of that per person. And they are getting better medical care than we are. And they're getting better results than we are getting. So Super Medicare for all will put us in a position to contain costs. It will be something that will be universal and applied to all. It will allow us to retain complete choice over who we will go and see to provide for our health needs. This is something that has to be made central to the debate on how we can make healthcare a right as it is in every other developed nation.